You're a little bit sleepy now, eh? As you can see, she's a little bit sedated, which is good. We want them nice and relaxed before we anaesthetise them. Yeah, it's how we go. So we just got her on a heating pad. Just once they're anaesthetised, they start losing heat straight away. So the first 15 minutes is really important, and obviously keep them warm and then warm during the rest of the surgery. So, all right. Just a tiny little cut down through the skin, so it just helps us get the catheter in a lot easier. This is her little anaesthetic. So we're just going to inject that through her catheter, just slowly, giving it a chance to work as she goes to sleep. So that goes straight down into her trachea, her little airway, and then we just hook her up to her gas. It's important we empty her bladder. It just sits right over where her uterus and her ovary sit, so we just don't want to damage that while she's under anaesthetic. So what we're doing here is continuously monitoring how deep she's under the anaesthetic, checking her eye position, has she got a blink, her jaw tone, and that means we can adjust her anaesthetic based on how deep she is. One of the other things we do is pop a little bit of lubricant in her eyes, just because so they don't dry out while she's under anaesthetic. Just a little bit there, just to help lubricate those eyes. Alright, we'll just take Izzy into the surgery ward. So I'm going to scrub, get my hands nice and clean, and then we'll go on in and start our surgery.
And as for our three-legged little friend, 2 weeks down the track, we find out what breed, but most importantly, no kidney problem.
She's a German Shepherd, definitely. She's doing really well. She's eating and drinking and obviously growing. Very happy, quite smart. She already sits. Sit, sit, good girl. With the leg, we only can assume, but we think her mother might have chewed her leg off, unfortunately, because she was so young that she wouldn't have been able to move by herself, so it must have been some type of terrible trauma. I'm fine. You want to see me do stairs? She can do stairs. She has a bit of a... Come on. Come on, puppy. There you are. Just remember you can use the chest, you're fine. Good girl. Look at you go. Look at you go.
Again, just a tiny little 5mm incision. Pop our camera in, let's see what we can see. Pop a little instrument that helps us grab the ovary. There's her uterus, just there. There's her ovary, there's her little, isn't that just beautiful? Kidney, intestine, so we just go in and we grab between the ovary and the uterus. Okay, what we're looking for is Joe's little hook coming through. So that's her ovary just attached to her abdomen, so we can cauterise it. Once it's cauterised, we just cut through it. Okay, we've got 2 little 5mm incisions that we're just going to close. So one little stitch, just be careful there. She can run around all she wants because it's not going to affect her running around. Normally a big wound, she's got to be quiet, so if a stitch has come undone, all the insides can pop out. This can't happen with the surgery, just Brant, and she's going to be so comfortable. This has been probably about 5 minutes since we turned her anaesthetic off, so she's just starting to wake up now. So it's just going to give a little manicure. Let's go! Two little spots, 2 little stitches, one there, one there. Yep. So that's all she did. You got it, hey? Good girl. So, just a couple of things we've got for her. These are just some anti-inflammatories. One of the important things when we're doing a major surgery, like we're doing with Junior, say, doing a knee reconstruction and checking his nose, is to make sure that every other organ in the body is working well. And what we've done is we've taken a blood test, and here are the results. So you can see here, everything is pretty normal except for this one here, the globulins, which is an antibody. Antibodies up, which is not surprising considering we know Junior's got an infection in his nose.
Next week we find out what's up with Junior. Has his operations been a success? And a Moggy survives a hanging.
He fell into the skylight and was hanging by his tail. The skylight must have closed on his tail.